Listen, whether it's stress, a headache, tension, trouble sleeping, we've all dealt with one of those, right? The real solution may not come in a bottle or a pill. Our next guest could help you ease the pain at home. Dr. Michael Ho is a chiropractor and acupuncturist, and he has devoted his life to the study of health and wellness. Welcome to our show.
Thank you.
I'm excited to talk to you because I've said this a lot. You know, Western medicine, we tend to treat the symptoms instead of the causes. So if I come in with a headache, you'll give me something to cure the headache, but we won't talk about what's causing it. So your philosophy is that, right? Identify and correct the cause of pain. And why take this approach?
Well, you know, there's certainly a place for Western medicine in emergency care and in many acute cases. But, you know, trying to treat the everyday common pain with a pill just doesn't work. We know it, okay? Because we need to identify the cause of the problem. For instance, if the light in the studio is flicking and there's a problem with the switch, it's no use, you know, cleaning the light bulb or changing the light bulb. We have to fix the switch. So if you have headaches, okay, you know, rubbing something in the head or taking a pill doesn't affect the blood flow or the nerve circulation to your head.
Yeah.
You got to examine the neck area to see if the muscles are relaxed, if the nerve is circulating right, the blood circulating right, and we can physically correct the problem by exercising, by relaxation, by sleeping properly, by acupressure point, and you know, different device for stimulation, relaxing muscle. If we can target the cause of the pain, we get faster and longer term, you know, results, and that's what we're after.
Do you think we as Americans have a problem accepting that approach? I mean, we're such a society where we want fast, quick results, and oftentimes, you know, these take time. They take a few sessions. You know, you can't just fix it.
I think it's a problem with the modern world. We've been educated to go for the quick fix. We don't have time to look after ourselves. We're not content, you know, with many things in life. So we always are rushing. We don't have time to do the little things that's important. And we've been brainwashed by a lot of the marketing out there that say, hey, do this for immediate relief. Instead of say, go look for that, you know, solution for long term, so you don't have to suffer for a long time. So it is a problem in America, and you know, we're trying to educate our patients and the public. There is better solution, very cost-effective solution you can do yourself to help yourself at home.
And outside of just physical pain, I mean, Jada, you're a certified counselor, you're a life architect. You guys talk to people who have problems in their life, and it's not always what it is at the surface, right? You guys dig for a deeper
Absolutely.
root.
I always look for the undercurrent. What's going on in their lives that's producing these symptoms, and we have to get to the core of it. And I love this because what he's saying is it's not just that headache, it's the tight muscles or it's something else that's going on underneath.
So we have a list of things that you had recommended, things that you can do. I don't know if we can show that now. So your back, for instance, so many of us have back pain. I mean, we type at computers all day. So here's some of the things you say you can do. You can warm up, breathing properly. How important is breathing to overall health?
Oh, absolutely important. You know, just think about anytime you stress, you're not breathing, you're holding your breath. When we do deep abdominal breathing, we relax our entire body. In fact, you can, psychologically focus on certain area of your body to relax during deep breathing exercise. Okay? I mean, how many of you wake up this morning with back pain?
Me. I got out of bed and I'm like,
There's so many things you can do to relieve that pain now. Without taking anything.
Why don't you show us something?
So I'd like to just go over a few things and a couple of very specific things. Okay. I recommend all of you, when you get up in the morning, you stand up, okay, nice and down, and very simple exercise is just gently turn from side to side.
What does that do?
Lead with your head because we're going to stretch the entire spine. So the head leads to the spine. So I'm looking behind me and I'm using my arm to generate some gentle momentum. Okay. That lubricates the joints. It gets the muscle nice and stretched out, and just get everything loosened up, okay? Very important, just loosen up. Now, if you actually have a disc problem or very tight hip or back muscle, I recommend you go right on the floor. So get on the floor here. There's one exercise you do.
Look at this.
You cross your leg, okay, the knee to the opposite side, and you gently go down.
Oh my goodness.
All right? Then stretch out the lower back muscle and the hip muscle. Very good for anyone with sciatic pain, just like that.
This is awesome.
So you just turn over and do this one. And you only need to hold it for about 20 seconds.
So we could do this in the morning before we hop in the shower or while the coffee's brewing, whatever.
Now for a lot of you, because you're slouching over the office all day, you just simply do some gentle extension. So just extending your low back like this. That feels really, really good.
I think our camera guy could use that because he is dipping down low right now. You guys can't see it.
Get up and I'll show you a couple of very specific exercises. Some of you may have pain right here. You say, people call hip pain, but really it's called the sacroiliac joint. What you do is, if I may. I just want to turn this chair around.
Please do.
You just support yourself, and you kick out like a horse, okay? I just taught my mom that recently.
Mom, you're a horse.
Boom. Just kick it out. And what you do is the momentum, the weight of the leg, pulling your pelvis back into the extension, into this position. Okay, women after giving delivery, the pelvis is loose when they come back together. Sometimes doesn't lock in the right position. You just do this, bang, bang.
Just watch out for kids and pets.
Yeah, don't kick anything.
And if your husband's bothering you,
That really helped the SI joint.
Now, what was the last one you did where you stretched?
Yeah,
Let's show them that
if you
real
have
quick.
degenerative disc where everything's compressed, what we want to do is we want to take the lumbar spine, instead of being slouched like that, we're going to gently extend it and elongate it. And so when you're going to the park or anywhere, find something solid, reverse your hand. And what you do, just take the weight onto your hands and just let your back relax while slightly extended. And just do that for about 30 seconds.
Looks like it feels good, yeah.
What it does is take all the pressure off your disc. It's just like hang up, upside down on a reversion table or using one of those traction belts.
But you can do all that at home.
You can do that anytime. Those of you who
Let's
are
turn
out,
this around so you can sit back down with us. Thank you so much, Doctor.
Yeah.
We're going to put that on our Facebook page, by the way, so you guys can do that at home. Maybe as you're online, you could stand up and stretch.
Yeah, I know. Yeah.
So thank you so much for those tips. We
Thank you.
appreciate it. We're going to play a game called Yes, No now. Okay, I'm going to pass these out. And the way we're going to play is, today's the invention edition. I'm going to show you some actual inventions. You decide whether no, this is over the top, or yes, oh my God, why didn't I think of that, all right? Here's the first one. It is called the iPotty. Parents can give children a comfortable and fun place to learn to use the potty with the child-friendly iPotty. You just stick the iPad right in there. Yes or no? You guys think this is good or bad? I'm going yes.
I like it.
Why the nose, guys?
I want to get the kids off the computer games.
I know.
Oh, that's right.
We're
Get them off
starting
until they're
early.
teenagers.
We're just talking about people not being on their smartphones, and now we want to get the kids to go to the bathroom with an iPad?
You know how dirty that thing probably gets, though? Okay, speaking of dirty, this one's called the baby mop. It transforms your adorable little baby into a valuable cleaning tool with plush leg and arm mop pads to take full advantage of baby's typically unproductive crawling movements, while also offering optimum comfort for your little scrubbing machine. Yes or no? You know what? Yes.
That is
Please,
exploitation.
God.
I like it.
Listen, thank you. Jack, my son, is all over the house. If he can at least do some double duty there, he
Why
already
not?
eats
Yeah,
like
I like
crumbs
it.
and stuff. I know it's really bad, but yes.
I like
you
it.
say
I
no?
like
What no?
Using the
little
child.
built-in
I
mop.
know.
They're doing it anyways.
I know. I don't have kids, so
What if
I'm
you
just
strap
like,
them to a
leave the
Roomba? Would that be
child
okay
alone.
if you strap them to a Roomba and
Yes,
just like all
that would be
that?
awesome. All right, check out this next one. It's the Fujitsu Next Generation GPS Cane. So it's a walking stick for 21st century seniors. So basically, you can put in where you want to go, and there's an arrow that tells older people where to go with the cane, and you can communicate back and forth.
I like
Yay
this
or
one.
nay, guys? What do we got?
I
Jada
like
says
it.
yes.
That's awesome.
Yes.
Michelle,
yes.
why you say no?
I only say no because
You hate old
I can.
people.
No, but they can barely check email. How are they going to use GPS in a cane?
Well,
Come
no,
on.
I'm thinking about for family members to be able to see where they are. So like for silver
Oh,
alerts, they
tracking,
can look, they
grandma
can
and
track.
I like
yeah,
it. You program in before you go out, and then it takes you where you want to
Yeah,
go. Especially,
yeah.
elderly Alzheimer's,
Yeah.
perhaps.
Yeah, that's not dementia.
See, now I
yeah.
feel like a jerk.
Yeah.
All right, here's the last one. Okay, this is air-conditioned shoes. Okay, these shoes don't run actual air conditioning; they have vents. So the filter technology releases heat and humidity in your shoe. What do you think? I'm gonna go with heck yes. No.
Come on, these-
I bet your feet are sweating right now. You
First
would love some of these.
world problems. Really, air-conditioned shoes.
I digress. All right. Anyway, we'll be back in just a moment with a really inspirational video. Thank you so much, Dr. Ho. We
Thank
appreciate
you.
you.